Welcome to Pawsitive Health, where we believe that pet owner education leads to better pet health. Just a quick disclaimer, any and all content of this video and this channel in general are to be used for informational and educational purposes only. They are not to be used for any diagnosis or treatment advice for your pet. Please contact your veterinarian for any specific pet health needs. Today, I'm joined with Devlin, my co-host, and my name is Dr. John Adam. And Devlin, what are we talking about today?
Well, a couple of sessions ago, we were talking about atopic, issues. The external factors that were causing itchiness in our pets. We talked about if your pets were itchy, it was also a sign, to check for fleas, that kind of thing. But what we didn't talk about enough was, food, the internal part that causes itchiness in our pets. And one thing I've wondered for a while is what's going to be the difference then between a food allergy and a food intolerance?
Very good question. So with food allergies, one of the big three allergies we see, the other ones being environmental or atopy, and then flea allergic dermatitis, is that's an actual immune response to the allergen via the flea bites and saliva, whatever allergen and the environments like grass, pollens, trees. And in this case, it'd be an allergen, most likely a protein, in the food that they're ingesting. While a food intolerance is just an adverse reaction to the food, it's not necessarily an immune reaction to that food. It's just your body not tolerating the current diet that they're being fed. So there's the difference. One's an actual immune reaction, while the other one's just an adverse reaction by the gastrointestinal tract from the food.
Okay. And so is that going to be something where like a grain or a certain brand are causing the reaction in the pet?
So majority of times it's going to be a protein, whatever protein that they're allergic to. Grain allergies are very rare. I'm not saying they don't happen, but they are very rare. So the whole idea that these grain-free diets are going to help with allergies is not true for majority of pets. So a majority of times, if we're going to be changing anything, it's going to be the protein in the diet.
Okay. And then is this primarily like a skin thing, a stomach thing, or is it a combination of both?
It can be both, can be one or the other, depending on the pet. In fact, if your pet does have gastrointestinal issues and itchy skin, then your veterinarian hopefully takes that as a clue as, all right, I really need to look into food allergies because most likely there's one thing causing both, and that would be the food. It can just be itchy skin. It could also be certain gastrointestinal issues like vomiting, diarrhea, decreased appetite, weight loss, among other things. So it can be either or both.
Okay. And then is this something that, like with the external ones that can just show up after, years of eating the food?
Yeah, most likely you're going to be allergic to something you've been exposed to, or if there's any cross-linking of allergies, like we do see if they're sometimes if they're allergic to, say, chicken, that they might have a pan poultry allergy. So even though they've never been exposed to, say, duck or turkey, they still might be allergic to that as well because of the allergy to the chicken protein. But that can happen at any time, and it can pop up later in life. It can be as early as 4 or 6 months of age. I've seen it very early on in a puppy's life sometimes, which is not fun. But yeah, that food allergy can happen at any time. Majority of times it's going to be early on, but it can happen later.
All right. And all right. So next, so that Discovery Channel doesn't sue us, let's scratch off some myths. So I know this is going to be something that, since we mentioned earlier, we're going to have a lot of pushback from a lot of the owners there. The big one is grain-free a free-for-all fix for the allergies? Or is it a
No,
fix at all for the allergies?
most likely it's not going to be a fix at all. Once again, it's usually the protein that's the culprit. Like I said, I can't say that there's no such thing as a grain allergy. I'm sure there are dogs out there that are. I personally have not seen that. It's mainly been the proteins that are causing the issue. And then the other issue with grain-free diets, not all of them, but there's a good chunk of them have been associated with heart conditions. So we get these dogs and cats that are not known for heart disease, all of a sudden developing heart disease. We saw that quite a few years back. And that got linked to these grain-free diets. And so we usually do not recommend these diets because of that, because the benefits, there's really not too much of benefit for going grain-free, and there's just too much of a risk involved in these grain-free diets. So we usually don't recommend those diets.
Okay. So if a pet owner wants to figure it out for themselves, one of the routes that is available to us in the open market is going to be those online tests where you send like a blood, saliva, hair. Thankfully, you don't have to send like stool samples, but so you send these samples. It's supposed to be super easy. It's supposed to be really popular. Do they work, or is it another myth?
So that is another myth. There really isn't any strong test out there for food allergies as far as via blood or hair follicles or saliva or anything of that nature. A lot of those tests in general aren't good for any allergy. There are blood tests for environmental allergies, and we do have environmental allergy panels that include a food allergy panel with it. But I don't rely on it because you can have a lot of false negatives, even false positives too. So I don't rely on those tests at all. The gold standard for testing for food allergies is a proper food elimination trial. And that's going to be, like I said, your gold standard for that, and also helps with treatment too. So it kind of takes care of two things at once.
Yeah. Okay. So once you found your protein, you're set, right? No, you can't be set.
No.
We already talked about how it can show up at any time, so it couldn't be that simple, could it?
Yeah, exactly. So you could switch to a different protein. They're doing well, and all of a sudden they'll become allergic to that protein as well. So it can be a never-ending battle, and that's why a lot of times, just to save the headache, I put dogs on and cats on very specific diets called hydrolyzed-protein diets. It kind of helps in general with food allergies and everything. So we'll definitely dive into that in a little bit with treatment. But yeah, just because you've been on this new diet and they've been doing well on it doesn't mean that they're going to stay okay with it. I mean, hopefully they do, but they can develop an allergy to that one as well.
Yeah. All right. So what about like our treats? Or I know you told me in the past that, some of the medications that we give our pets, they're flavored to be like certain things. So
yeah,
like if they're based on that protein flavor wise, is it going to be an issue, or is it just if they contain that protein in them?
Yeah, and they definitely can be. Certain even medications like heart medications can have flavoring that will be not great for an allergy if you're allergic to that, beef flavoring or anything like that. It still can trigger an attack. There are a lot of flavoring nowadays with medication specifically that companies do a better job of hydrolyzing those flavors. And what that means is that the proteins are broken down so finely that the body will hopefully not react to it. It's not foolproof. You still could have a reaction, but it's much less likely than if it's just straight up protein flavoring. So you do have to be careful of that. Discuss that with your veterinarian, and with your veterinarian, you can kind of figure out what you can and can't give to your pet.
Okay. And now, since it's one of those things where it can just, come about after years of eating the food, if it's super quick and sudden, like yesterday they were eating chicken and they were just fine. Today they eat chicken and they're like scratching for hours. Can we rule out that it was the food and that was something else, or can we not?
No, just like any allergy, it can happen in a moment's notice. I mean, just because it happened really quickly doesn't mean it's not from the food. In fact, it definitely can be. I mean, just like with us. I mean, you eat something you shouldn't have, and all of a sudden, a couple hours, you're not doing so hot. So,
Yeah.
same thing with pets. They just they can react to anything pretty quickly as far as allergens.
All right. You said, so we can't do this test, that was one of the myths, but you said that there was a gold standard. Talk about that one. What's the gold standard that we should be doing?
Yeah.
Having
So
you
our
do
gold
it?
standard test is your food elimination trial.
Hmm.
What that means is that you're going to be either finding out what your pet has been exposed to as far as diet wise, and trying a novel diet. So something they've never been on. So say they've been on a chicken diet their entire life. Okay, let's switch it to a beef diet or a venison diet. And we want to make sure that anything they consume as far as proteins go is compatible with that diet. So, say you're doing a beef diet, everything has to be beef flavored. You can't add a chicken flavored treat or anything of that nature. So anything passing through those lips have to be the same thing as the diet. Or what we usually do nowadays, because unfortunately pet owners switch diets consistently, and so we never know exactly what they've been exposed to. We'll actually use these special diets called hydrolyzed-protein diets, and I was mentioning that before. Those diets are broken down so finely that your immune system will hopefully not recognize it as whatever protein it is, and so not react to it. And so with these diets or novel protein diet, we want to try that for usually 8 to 12 weeks. And then after the 8 to 12 weeks, the true test is we actually reintroduce their old food and see if they react. If they react, then we know we got a food allergy issue. And then from there, we kind of decipher what we want to do as far as sticking with the hydrolyzed protein diet, finding another diet that they're okay with, or even testing individual ingredients to see what exactly they're allergic to, and then trying to avoid those ingredients.
So basically, once you've identified that your pet is allergic to something, go through this elimination process and just be ready to pivot, when you find something that is causing it. And, but so then for that regard, Lynn, is it always better to just have like backup proteins just around?
I wouldn't say just to have backup proteins. You never want to just keep switching up the diet, because
Okay.
that can cause other issues. So you kind of want to just whatever's working, stick with it, and until it doesn't, obviously, and then you can pivot after that. Just finding a good diet that works for your pet and sticking with that diet and being consistent is the key.
Okay. And then so the novel protein, that's the novel like new. So the new protein, that's the one that's working. That's the whole protein, right?
Mm-hmm.
And then the hydrolyzed diet, that's just one that's been through a blender basically until it's broken down to its finer pieces.
Layman's
right?
terms, yeah. Your
Layman's terms.
Exactly. So yeah, instead of just this whole big protein, it's just chopped up. And so because it's all chopped up, just like anything else, you shred a letter, you don't really know, or you don't kind of recognize that letter anymore, or recognize that picture anymore because you shredded it up so much. You still can digest it, process it, and get the proper amino acids out of it and everything. But your body doesn't see it as the foreign object that they need to react to, like they did with the whole protein.
Yeah. And then, we've seen as well, the pet food stores, the ones that just have like the limited diet. Is that better than, in this regard, the ones that have, the fewest amount of ingredients on their back?
So usually when we're doing a novel diet, we do want to have limited ingredients. You do have to be careful though with over-the-counter limited ingredient foods because they'll say that they're just potatoes and fish or whatever it may be. But then when you actually look at the ingredients, they've added chicken byproducts and other stuff in it to kind of add filler to the diet. So there are very specific like selective protein diets out there that are good as far as just being whatever they say it is. Chicken and not chicken and rice, but like a duck and potato or venison potato and all that. And those diets are usually carried by veterinarians. And so you can ask them and they can recommend a diet for you. You can ask a veterinary nutritionist. They can make a diet for you as well or suggest a diet that's already made. So there's options out there.
Okay.
But you just have to ask your veterinarian. They may refer you to a nutritionist as well to figure out what diet will work best for your pet.
So how do they then decide between, like, say, a novel protein diet and the hydrolyzed diet?
So both will work pretty well usually. But once again, at least for me, I tend to go towards the hydrolyzed diets because once again, when I see a pet and they have a suspicious of food allergies, and I go through the history of what they've been fed, the owners have already switched the food like 5-6 times. And so it's really hard to navigate and figure out what exactly they've been on because they'll tell me, like, I've been on this diet, and I'll ask them, do you know what the ingredients were in it? And most pet owners don't know. So instead of just guessing, I would like to start off the food trial right the first time. And so I usually use a hydrolyzed protein for my elimination trials. And then from there, we can kind of figure out the different proteins that we're having issues with or not having issues with after that. But if you can give your veterinarian exactly what your pet's been exposed to, then they can use a novel protein diet as well, because as long as they have a thorough history of your pet's diet, they can select something that they've never been exposed to and use that.
Okay. And then I'm just assuming here that since these are things that can show up at any time, that no matter what we try, once they've started to exhibit allergies to food, there's no real cure. Then it's just management, like, other stuff, right?
Yep, just like all the other allergies, there's no cure for them. You're just managing them for the rest of their life. Food allergy, though, can be very simple. Like I said, you're just avoiding their allergen as best you can. So it's a lot easier than, I would say, environmental allergies, where they usually have multiple allergies, and it's most likely something you can avoid. And so you're just trying to manage that reaction to the allergen. This one, you can avoid that allergen. And usually we do that, once again, through a novel protein diet or a hydrolyzed protein diet.
So, I mean, man, like, how are you going to figure this out then if it's something like, food allergy and environmental allergy at the same time? Like, as a pet owner, how do you know if you've eliminated one, or if you found the cure for one? How do you know if it's working if they're still itching from something else?
Yeah, and that's where just having that communication with your veterinarian, having that patience with your veterinarian to figure it out, and just going step by step. Usually we try to rule out fleas first and put them on a good flea control. And then after that, if we're worried about or suspicious about food allergy, going through that elimination trial and figuring that out. And then if we're still having issues, then maybe doing an allergen test. So it takes time. It definitely takes time. There's a lot of steps involved. And so being patient with your veterinarian as they work through it with your pet, eventually you'll figure it out and get it done. Just like my own dog. I mean, he's allergic to everything. He's got a hydrolyzed-protein dye. He's had immunotherapy. He's horrible with fleas, and he's still got awful allergies, but just managing it as best we can, basically. So it's just it's a process, and it's frustrating. It definitely is very frustrating for the pet owner, very frustrating for us as veterinarians too. But if we can work as a team and have that compliance from our pet owners and just going through the process, it'll make it a lot easier.
All right. So our viewers out there, you're watching us, you're saying that sounds a lot like my pet, maybe from, our environmental one, maybe from our food one. What's the very first thing you want them to do at this point then?
As far as pet owners, come to your veterinarian. Come to us, explain your concerns, and we can formulate a plan with you. And that way we can do it right the first time versus just kind of randomly switching different diets and hoping that it'll work. Just get that plan from your veterinarian to hopefully figure out if we have a food allergy and what we should do about it if we do have a food allergy.
All right. And then since, life isn't cheap, to help our viewers save money, what would you tell them to save money on and not waste their money
on? Definitely don't do those allergen tests for food allergies. They are definitely a waste of money. Don't need some fancy diets that claims to treat food allergies. I mean, I always tell people if your dog's allergic to chicken, you can give them the most gourmet organic chicken in the world. They're still allergic to chicken. And so with that, you don't need anything fancy, just a diet that they just don't react to. And it could be any diet. Obviously, you wanted a well-balanced diet, but any diet that doesn't have their allergens will work.
So I don't have to hire a personal chef for my dog?
No, I mean, there are some out there, though, if you really want to. I mean, there's good companies out there, too, like, well, I guess I'm not necessarily advertising for them. They're just Food for Dogs. I mean, they're a great company. They have their own veterinary nutritionist you can talk to as well. They got great diets. There's other companies as well. But, yeah, there are diets out there that can be specifically made for your pet via a nutritionist. Just Food for Dogs is one company. There's other companies as well. And other nutritionists that can help you out with that.
Nice. All right. Well, those are my questions. I'm sure somebody else will have other questions. So if so, down below, comments. Yeah. John, you got any final thoughts?
Yeah, and just like you said, any other questions or any other topics you want us to discuss, just drop a comment below. Like and subscribe if you found this video helpful. Also, we do have a school community, which we'll provide a link down on the description below, where you can join like-minded pet owners in discussing your pet's health and can have live Q&As with myself, as well as other resources for your pet and your pet's health. And that's it for today.
Sounds great.
All right. Take care, everyone, and thank you very much for watching.
See you next time.
Take care.